Okay, I am doing a head to toe with an appendectomy patient. I am going to come in the room. I am going to provide privacy. As I walk in the room, I am going to perform hygiene, put on gloves. I'm going to do my 60-second assessment around the room. I am going to look for emergency equipment, check IV lines, make sure that, see if they have a Foley or SCDs on their legs. I am also going to check for airway distress, breathing, circulation. Their color looks good. As I come in, I'm going to introduce myself. Hi, I'm Stacy. I'm going to be your nurse today. I am going to just assess your appendectomy area, and then I'm going to do a whole head to toe because I'm just coming on my shift. Is that okay?
Yeah.
Perfect. And how is your pain on a scale of 1 to 10? In your
2.
Perfect. And what is your tolerable pain level?
3.
Okay. So if it gets to a 3, let me know and we'll get you some pain medication, okay?
Yeah, thank
We
you.
want you to be as comfortable as possible. That promotes healing. So
Thank you.
I am going to just check your name and birth date. What's your first and last name?
Insipon,
Okay, and then your birthday?
August 21st, 1981.
Perfect. All right, wonderful. I am going to go ahead and put your bed up. I am going to perform your vital signs first, just to make sure we get that in your chart. It is. All right, so I have performed her vital signs. All of her vitals are within normal range. The first thing I'm going to do is assess. I'm going to go ahead and pull your blanket down just a little bit and then pull up your gown just so that I can see your abdomen, if that's okay.
Yeah.
All right, perfect. So I am doing a physical assessment of her abdomen. I just want to make sure that there is no purulent discharge coming out of the incisions. The incisions don't have any redness or swelling over what's to be expected out of surgery. I don't see any distension of the abdomen. I am then going to do, I'm going to listen to her bowel sounds, osculate. I'm going to start in the lower left quadrant, but be very gentle. I am going to just barely be pushing on the skin because her whole abdomen could be tender. Listen to 15 seconds in each quadrant. I'm going to very lightly put my stethoscope in the bottom left-hand quadrant where her 3 incisions are. And I'm going to make sure I'm not putting it on top of the incisions. All right, so I hear active bowel sounds. Have you been able to pass gas since the surgery? Perfect. And have you had any bowel movements?
Yep.
Gone to the restroom? Okay. When did you go to the restroom?
1 hour ago.
Okay. And then what were the characteristics like? Was it like soft serve ice cream? Was it bumpy, hard?
It's normal, like sausage and soft.
Okay. Perfect. All right, wonderful. I'm going to go ahead and just do a little palpating. I'm just going to touch your stomach. I promise not to touch in the area that would be most sore. I just want to make sure I don't miss any maybe masses or anything that feel anything different than I'm used to. Okay, everything looks good. The next thing I just want to, I'm going to go ahead and check her skin on her face again, just to make sure that she is pink, dry, she's not sweating. I'm going to go ahead and just check your head. Have you had any ringing in your ears, headaches, anything like that? Okay, so I just want to, because you've been laying on a bed, I just want to make sure you don't have like an indentation on your head or anything. I'm going to check her ears from when she had the things for the surgery. I am going to check, can I have you look up at the ceiling? I just want to check your trachea, check for DVT or JVDs, but I don't see any. I'm going to go ahead and, let's see. pocket. I found it. Okay, so I am just gonna go ahead and I'm gonna check your ears. Any ringing in the ears?
Nope.
All right. Can I go ahead and get you to open your mouth? All right. Checking your membranes. They look dry. Everything looks okay. All right. So I'm gonna just ask you a couple neuro questions, just to get a baseline, if that's okay.
Yeah.
Can you tell me what the month and year is?
March 25th.
Okay. March 25th?
March 2025. Yeah.
2025. Perfect. And then can you tell me where you are?
Sharp Ghostma.
All right. And then what are you doing here at Short Grocery?
A new check.
Perfect. All right. So she is talking to me. There's no slurred speech. She is alert and awake, ×4 for level of consciousness. I am going to go ahead and I'm going to just check your eyes, if that's okay. I just need to check for reactiveness. Can you take your glasses off for me? Perfect. And I'm going to look, and her eyes are 4 millimeters. And I'm going to go ahead and just check the reactiveness. All right, so I'm going to check one for direct constriction, and I'm going to look for partnering. I'm going to check the other eye for the same thing twice. Okay, so I just want you to look at my pen here and just follow my pen, okay? One more time. Great, her accommodation looks to be reactive. Her reactions are brisk. Now I'm gonna have you do just a couple more things that are kind of be silly, but can you raise your eyebrows? Perfect. And then can you blow out your cheeks? Awesome. And then smile. And then frown. And then stick your tongue out. Great. So her face is symmetrical. I don't see any kind of neuro distress. The next thing I'm going to check is your lungs, if that's okay. Have you had any shortness of breath, coughing?
No.
Have you been coughing anything up? No. Do you smoke?
Nope.
Perfect. So I'm going to go ahead and, if you don't mind, I'm just going to check out your thing. I'm watching her breathing, making sure that it's symmetrical. She doesn't seem to have any labor breathing. She's not using her accessory muscles. I'm just going to listen, if that's okay. Alright, so I'm just going to... And I'm going to be listening on both sides to compare. As I go down, I'm going to check on the auxiliary areas. All right, great. Lung sounds are clear of crackles and wheezing. Can I get you to, we're going to have you turn to the side so I can listen to your back. Can you put your knees up? Perfect. And then hold on to the bar and we're just going to roll you. Awesome. So now I'm going to listen, starting with the 10th rib in the middle of her back, on one side of her spine. I'm going to listen for each breath, have her breathing in and out every time I move my stethoscope. And then I'm going to check the opposite side. I'm going to check mid-scapular line. She's going to be breathing in every time. Checking the opposite. I'm going to check the apex of the scapula on either side also. And then while she's turned sideways, I'm going to go ahead and I'm going to assess her elbow for pressure ulcers, and then I'm going to just look to make sure that her back is dry, warm, her skin doesn't have any beginning of pressure ulcers. I'm going to check her sacral area for the same thing, check for her hemorrhoids. Since she had abdominal surgery, if she pushes, that could be traumatic for those incisions. All right, all the way down to her legs. I'm going to check her heels, pull down her socks if she has them on. Okay, everything looks good. Go ahead and come back. Are you okay?
Yeah, I'm okay.
All right, perfect. So the next thing I'm going to do is listen to your heart. Have you had any fluttering? You feel like your heart rate's racing? Anything like that? Palpitations where you feel like your heart's beating really hard? Good. That's good. So I'm going to check the 5 points. Starting with the atrial. I'm going to listen for a couple beats each space. Pulmonic, Erb's point, tricuspid, and then I'm going to listen to apical. Apical will be listened to for 60 seconds. So I've listened for 60 seconds. Her heart rate is 70. It's a regular heartbeat. I can hear S1, S2, no signs of murmurs. All right, so the next thing that I am going to do is, before I start with your extremities, that's one of the last couple things I've got to do. Have you voided? Have you gone to the restroom and peed? And when did you do that? When was the last time you
1
peed?
hour ago.
Okay, and then can you tell me about the what it looked like? Was it yellow, pale? Did it smell funny? Anything like that?
It's yellow, it's normal.
Okay, any burning or anything? Any abnormal vaginal discharge? Great. So the next thing I'm going to do is I'm going to check your arms. Can you tell me if you have any pain in your arms, if you're numbness, tingling, anything like that? No, you don't? Okay. So I'm just going to go feel and let me know if you feel any pain as I go down. As I go down, I'm checking to make sure that she doesn't have any pressure ulcers on the bony prominence. I'm also making sure that she is has pink, dry, warm skin. Once I get to the end, I'm going to do cap refill on all of her fingers. I am going to check her radial pulses to make sure that they are bilateral. They are bilateral and they are +2. I am going to check for her reflexes to make sure that they are equal on both sides. Can you go ahead and squeeze my fingers hard? Okay, and then I'm gonna go ahead and pull, and you pull back. Perfect. If you can push on my hands with your hands, or your yeah, and then I want you to go ahead and pull towards yourself with your arms. Yeah, there you go. Great. Okay. So everything, her reflexes are good. They're even on each side. The next thing I'm going to do is check your legs, if that's okay. Any pain or tingling or anything like that? All right, so I'm going to pull your blanket up, and pull your gown down, but I'm going to pull up from your feet, if that's okay, because I need to be able to look at your legs.
Okay, I have a pen.
Perfect. So now I'm going to squeeze. Let me know if anything hurts. Yes? No? Everything's good? I'm going to have you lift. I'm just going to check to make sure I didn't miss any sores. Okay, so go ahead and bend at your knee. Push against my hand with your leg. Yep. Now push down on my other hand. There you go. No. So go ahead and let's do the next one. So bend it at your knee. Push down on my hand. Awesome. Now push up on this one. Very good. All right. So I'm going to take off her socks. I am going to make sure that her feet look okay. I don't see any sores in between the toes. I'm going to check the cap refill. I am going to check her dorsal pedialis to make sure that they are equal bilateral. They are +2, which is normal. I'm also going to check her posterior tibialis, and those are also +2 bilateral. Go ahead and push on my feet as for resistance, and then push down with your foot. Nice. Okay, everything looks good. So tell me, do you have any family coming to visit you while you're in the hospital?
Yeah, my parents and my sister.
Okay, and is that who you live with?
Yeah.
Great. So you have support. Are they going to help you when you get home? You just got to make sure you're not overexerting yourself.
Oh yeah.
Wonderful. Okay, so I'm going to go ahead and give you your call light. Let me know if I can do anything for you. I'm going to put your bed down for safety. If, like I said, your pain gets to that 3, I'm going to come back and I'm going to check on you in about an hour. Let me know if it's before that, push the call light, and I'll come in, I'll bring you some medication. Again, our priority is to make sure your pain management stays down and that you're infection free, okay?
Okay, thank you.
All right, have a good day.
Have a good one.
So I'm going to take off my gloves, perform hand hygiene, And that's it.